We'll just give people a couple of minutes to trickle in. Okay, now that we have a good number of people already, maybe we should get started, given you have to rush to your next thing. So it's my distinct pleasure today to introduce to all of you Tim Althoff. Oh, by the way, if you don't know me, I'm Swabha Swamgupta. I'm an assistant professor and also the co-associate director of the Center for AI and Society. And we are hosting our first and maybe only virtual seminar of the semester today. And it's my distinct pleasure to introduce to you Tim Althoff, who is currently an associate professor as of a few days ago at the Allen School of Computer Science and Engineering at the University of Washington. So Tim's research is in the AI and mental health space, where he combines research from data science, natural language processing, social networks, to better understand and empower people. His AI research has directly improved mental health services utilized by over 10 million people and informed federal policy. He's one of those rare AI researchers where his research is actually touching people's lives. So this is extremely relevant to the Center of AI and Society. Tim holds a PhD degree from the Stanford Computer Science Department and has received so many awards at conferences all across the board, WWW, ACL, twice at ICWSM, UBICOMP, and IMIA. And he also has the NSF Career Award. And Tim's research has also been covered widely in media across US and international outlets, BBC, CNN, The Economist, The Wall Street Journal, and The New York Times. So we are very excited to learn about Tim's research on language models and mental health. So take it away, Tim.
Thank you so much, and thank you for the invitation. I'm always thankful that we're recording many of these talks, so I can listen to these exceedingly kind introductions again. I wish I could be kind of down in Southern California with you all, but I really appreciate everybody attending and the invitation to come share some of our work around human-AI collaboration and mental health with you. I'm trying something new in this talk where I really want to get at this training wheels metaphor, where I'm especially more recently excited about using AI as training wheels, like on a bike, to improve mental health, where, and I'll talk more about this, where the key part about training wheels is that they're meant to come off eventually, really focusing on our actual learning and skill building. Before I get there, I know this is an AI seminar, and lots has happened in AI recently. We now have household names like your Geminis or ChatGPTs, and in some sense, these are machines that can listen to you, respond to you, translate between languages, solve some problems, learn, retrieve information, seemingly express emotion. And like, this is really remarkable and something that used to be science fiction until relatively recently, where, of course, our lovely C3PO was famously fluent in over 6 million forms of communication, and probably pretty close to USC campus. Now, I understand that this is a highly multidisciplinary seminar, which is awesome. So I want to take just a minute to make sure we're on the same page about what language models are before we dive into more about what we can do with them. So language model is simply a computer program that's designed to understand and generate human-like text. And it learns these patterns and structures from just crazy large amounts of data of written language to be able to learn these type of patterns. In fact, this language model definition was generated by such a language model. It's an example of the type of text that these models can generate, for instance, in response to a question like, what's the language model? And these models have gotten quite powerful. And there's actually a really simple idea at the core of it that just turned out to be just particularly effective at training these models. And this is kind of this basic idea of filling in the blank, or what's called mass language models. So if we have a sentence like here at the bottom, how are blank doing today? We all know what we could fit in here. How are you doing today? How are they doing today? How are we doing today? And language models are trained by often filling in this blank a billion, sometimes a trillion times. And when you have to do that, it turns out if you get really good at filling in the blank, you really have to start learning a lot about language, about grammar, about semantics, and so on. And using kind of advanced forms of computing, we were able to train these very, very large models to do that. With that, if we were in person, this would be a lot less awkward. Usually I would ask you guys here, who's learned how to ride a bike and who has learned to do that with training wheels? And I'd expect that there would be quite a few. I see at least some hands going up. But when I then ask you who is still using these type of training wheels today, it's usually a lot fewer, and that is intentional. So these kind of training wheels, I like this metaphor because they provide some additional support while we're learning a new skill of riding a bike. They make it easier for us to practice this new skill. They make it safer, right? Like in some sense, we only have to focus on so many things at the same time, and we don't have to have perfect balance at all times. We can focus on steering and braking and whatever first. So for a brief period of time, these training wheels really helped us learn, but then they're meant to come off. Maybe a little bit less obvious, sometimes we actually make things actively harder to help us learn, and it might be a bit difficult to see, but the person here in front of this picturesque background is running at high altitude, actually with a weighted vest. So maybe they're practicing for a competition near sea level, but sometimes we actually make it harder for us to really master certain skills. Now, there's some skills, especially skills that are related to our mental health, to our relationships, and who knows, maybe they could help us maintain a healthy democracy as well. Some skills that I find particularly important, a few of which I'll introduce now. One such skill is empathy, which is the ability to understand or share the emotions and experiences of others. Another important skill is emotional regulation. This is our ability to manage and express emotions appropriately. Another important skill is conflict resolution. Conflict is quite normal, but it's good to have healthy ways of dealing with it. So can we actually, the skill of our ability to address disagreements constructively. And we could go on and on in terms of important skills. And I'll only share one more. In cognitive flexibility or reappraisal, our ability to be open to new information, to be willing to change one's mind in face of new evidence, being willing to change your views and perspectives. And one thing that all of these skills has in common is that it's actually quite hard to learn and exercise these skills. These skills are challenging, they're often uncomfortable, if not outright painful. So right, like if AI is so powerful, why don't we outsource them to some language model? If it's so painful, why don't we let somebody else do it? And at least thankfully, of course, I'm kidding here. And it's actually something I'm quite concerned about because we now have these 24/7 AI assistants for absolutely everything. But I think there's some skills that are just too important to outsource them to AI. And we commonly find ourselves in scenarios where we ourselves have to be able to exercise those skills for direct personal benefit, for direct societal benefits. So those are situations where we might not have those training wheels anymore. But I worry about this because AI assistants today are, I don't know, very, very convenient. They're extremely agreeable. I've started calling them pathologically helpful because they will try to help you no matter what, even when that doesn't make sense. And I do worry that they essentially kind of create a world around us where kind of key skills like conflict resolution are kind of don't come up until you really need them and are not ready for them. If you haven't seen kind of crazy examples yet of language models being super agreeable, I did this when I was preparing yesterday for this talk. I put this into ChatGPT. I think Tuesdays are just the worst day of the week. Don't you agree? Of course, the language model agrees. I actually had to abbreviate it here because I'm not comfortable reproducing all of that on the screen here. But almost kind of for no good reasons, these models are just so nice and agree with us on everything. So now if we actually care about learning skills like conflict resolution or cognitive flexibility, how would we do that? And I'm a computer scientist. I'm thankful that we can build on decades worth of research from education and learning theory here that really ties into our training wheels. So if we really want to learn something, we can start by providing supportive scaffolding, basic, like understanding the basics of some tasks through some basic structure. We might move on to deliberate practice, focusing kind of on specific areas of some skill that we want to learn and do this intentionally and purposefully. And finally, we can learn through constructive feedback, either during or after a practice session, and then maybe return to practice with this feedback in mind. And teachers do this every day. I think it's pretty clear that language can provide such scaffolding, practice, and feedback, and we see this in classrooms every day. But I think it's also therefore the case that language models could help provide this type of supportive scaffolding, provide opportunities for deliberate practice and personalized constructive feedback as well. And I want to illustrate this kind of basic hypothesis with two projects I want to show you today, where we teach people critical skills, but then we evaluate them in this kind of training wheels off type scenario. So I just mentioned it, kind of these training wheels are supposed to come off. We will measure performance without training wheels. And in some sense, I want to discuss how to design human AI interactions that empower people to really transition from a reliance on AI to real mastery of a skill, so that this AI support is only kind of a temporary training wheel or a stepping stone rather than a crutch. So in many ways here, we're designing AI support with planned obsolescence in mind, so we can focus on kind of effective and sustained learning outcomes. So project number one and skill number one is about reframing of negative thoughts. And I love kind of starting with this photograph here, which was part of a really awesome art campaign called Let's Talk. This was done with full consent as part of this art campaign. And here we see an individual, Nathaniel, who chose to share his personal story in this campaign. And I really like showing this picture because it illustrates that we all have negative thoughts, that we actually express them through language, even if we don't make it as explicit here as the artists do so explicitly here in his face. And in some sense, we're communicating with ourselves. We express our thoughts through language. And I believe that human AI collaboration and language models can help us with that as well. So I'll pick on myself next, but I'm relatively convinced that we all have negative thoughts. Certainly, I'd appreciate not to be alone in this one. Turns out a good fraction of the time when I submit research papers, they get rejected, and I might receive this with thoughts. It's like, well, I'll never succeed as a researcher. And I know we might say, well, that's just a thought, but it actually, these thoughts can matter a great deal because they relate to our feelings and our behaviors. I might feel a lot worse about myself, might feel frustrated, and might engage in behaviors that are really not in my best interest in the end. But it's really, really hard kind of to deal with these thoughts. They're often entrenched and automatic. They're emotionally triggering. And thankfully, there's actually proven therapeutic techniques out there. For instance, one called cognitive reframing, which is this idea to challenge this negative reflective thought with a reframed, different, more balanced, healthier reframed thought. So instead of I'll never succeed as a researcher, or like maybe I could have a thought is like, well, Tim, it's actually pretty normal to feel disappointed when a paper gets rejected, and we can use this experience to learn and grow. And this is really at the core of a particular popular form of therapy called cognitive behavioral therapy, a form of therapy that has a particularly large amount of an evidence base behind it. And again, these reframed thoughts, they matter because now I might have, this might come with different feelings and behaviors. I might feel more optimistic, I feel better about myself. Instead of maybe procrastinating, I'll actually might seek feedback from friends or colleagues as I'm doing here today. So now this is basically the state of the art, how reframing is done most of the time. It's often supported by worksheets. Like this one, and here you see this last column of an alternate thought, which kind of provides some basic structure, but is still kind of a relatively empty piece of paper. And this is just like we've learned in so many ways that this is just a really difficult task to do. And in many ways, all that people get as support, whether that's kind of a homework, if you're lucky to work with a therapist, or for most people, this is actually just a PDF they might come across online. This is really difficult, kind of a difficult skill for people to exercise and learn, because again, negative thoughts can be entrenched and automatic, emotionally triggering. It's amazing to have therapists that can teach you these skills. However, we live in a world where access is extremely limited, or we don't have enough clinicians to take care of everyone, where your insurance might not cover it and might not exist in the first place, stigma and many other reasons. So this led a super awesome organization, nonprofit called Mental Health America, and our research team to hypothesize that maybe we could use AI to provide better scaffolding that might make these skills much easier to learn and engage with in a way that we could make widely accessible. And next, I'll show you a demo of this system. If you're familiar with this cognitive reframing process or CBT processes, this will look very familiar, and I'll point out where kind of AI comes in what way. So first, we'll start with the negative thought we're struggling with, and I'll pick on myself again. I'll never achieve success as a researcher, but you can also see here on the bottom what most people are putting in, where like there's lots of heavy thoughts like I'm a failure, no one cares about me, I'll never be able to do anything, I'm worthless, and so on. We did learn that it's really helpful to ask about a situation in which this thought came up. Basically, for an AI to truly be able to help you, it needs to know enough context about you. And that can be a big tension because we need to provide value quickly enough. Otherwise, people just move on and do something else. But we did find it really helpful to ask for this context, for instance, getting a research paper rejected. And now AI comes in for the first time. So everybody could learn this kind of skill if we're willing to sit down with the right book and maybe, I don't know, 30, 40, 50 pages about different types of cognitive distortions that we hear called thinking traps. But this rarely happens, and when people are going through something, this tends to be a tall ask. So what we can do here, we can use an AI model to figure out of all the, I don't know, 10, 20 different kinds of cognitive distortions, we can figure out what's most likely going on in Tim's thought. And for instance, like there's maybe overgeneralization, fortune telling, all or nothing thinking, all of which are true to some degree. And then I can pick one to challenge. So in some sense, rather than just abstractly learning this type of skill for kind of all situations, we learn about the parts that are immediately useful to me right now, and we can cover some of these others later. And I'll click on overgeneralization here. And now maybe the most difficult part for people comes, and maybe the most exciting part from an AI perspective comes. Now we want to come up with these reframed thoughts. This is extremely difficult. Sometimes these negative thoughts might be kind of reinforced through decades of trauma. This is where most people drop out. This is really difficult. So we use kind of a bespoke AI model we build to generate at least 3 different starting points, and we generate 3 in the hope that everyone using this tool finds at least one that they can relate to as a good starting point to then make their own. And I'll read them out here. One says, it's normal to feel disappointed when something doesn't go as planned. I can use this experience to learn and grow, and I'm sure I'll have more success in the future. Another one says, rejection is a part of the process. I'll take the feedback I received and use it to improve my paper and submit it again. And while I won't kind of show even more details for this demo for time, now kind of there's a few more steps how people can make this their own, adapt this thought. This is not meant to do your thinking for you, but it's meant as a starting point when this is really difficult. And this is, again, in contrast to a piece of paper that just doesn't have the same affordances. I know these kind of worksheets are amazing. They've been kind of intentionally designed, but they don't have the same affordances in the sense that this piece of paper doesn't listen to me, respond to me, support me, adapt the ability as needed, and so on. And so in collaboration with mental health experts, with clinical psychology, with patient advocates, and after systematic ethics and safety considerations, after ensuring high quality and safety, we actually deployed this model publicly, and it's available to everybody now for free, either at this URL or QR code. I'll also show the QR code at the end of the talk if you want to try it out. And we were kind of through working with this amazing nonprofit organization, Mental Health America, we were able to kind of freely offer these services to over 160,000 people over roughly the last 2 years. And because of the underlying technology, we were able to do dozens of different randomized trials that we were able to learn a great deal from. And I want to kind of point to some of the highlights of what we were able to learn next. The first thing we learned, and this was prior to randomized trials, I want to clarify, is that engagement rates went up a good amount. So this intervention around cognitive reframing I explained is an extremely standard, extremely well-known intervention that even this same website had resources about already. They were just kind of roughly a digital form of a worksheet rather than a process that's kind of designed to really support you at the points that's hard. And we saw kind of immediate increases in completion rates from abysmal to not like far from perfect, but about 8 times higher. And it really strikes me personally that we can actually already, even without optimizing these tools for costs at all, we can already make these tools available for less than a few cents per use, which is actually less than printing a worksheet, and much, much less if a human being has to hand you that worksheet, actually. But it wasn't only more engaging. For instance, we saw through large-scale randomized trials that people actually found the reframes they came up with AI support more helpful versus just doing them by themselves. And these are pixel by pixel identical comparison groups, just having kind of empty text boxes instead of kind of these AI starting points I introduced. We also found that people find that they are actually able to learn the skill in a better way kind of through this AI support. We find that most of the time people feel better. I think kind of a hardcore cognitive kind of therapist would point out that this is primarily a cognitive rather than an immediately emotional intervention. But we do find that about 70% of people actually feel better after just kind of like a 3 to 5 minute intervention. And we were able to learn a lot about how to kind of generate the most effective reframes. And that was kind of an interesting piece where we're able to inform psychological theory about what actually makes a particular good reframe for you, to a degree that nobody kind of with access to just dozens of individuals could do before. So where we started with this project was that it was kind of well established in this world of research that reframes need to be relatable to the individual. They should be helpful in overcoming the negative thought, and they should be memorable, because chances are you've had that same negative thought before, and chances are it's going to come up again. So if you can challenge it a little bit easier next time, that would be a success. Now, what we didn't know is like, what does that actually mean? Like, how do you generate a thought, a reframe that is relatable and helpful and memorable? So together with a much larger team, I'll introduce at the very end of today's talk, we came up with a couple hypotheses of what it might look like to optimize for these different outcomes. And then we developed computational methods to measure and control these attributes. Kind of eventually all validating them with domain experts. So we would build natural language processing methods to measure how rational something is, or how positive it is, how empathic it is, or to change the level of how actionable a thought is, how specific it is, or how readable it is. And then I showed you earlier, we were showing people 3 different types of reframes. So we could kind of switch those out in randomized ways to learn a lot about what types of reframes actually resonate with people. And here's the one people clicked on. So this is not necessarily about downstream outcomes. This is the one people selected of the 3 that they really wanted to work with. We learned that when reframes were highly specific, people kind of wanted to kind of preferred those a lot more. Also, when they were more empathic, like that often feels a lot better to work with. We learned that making them more positive is actually not particularly useful. It's easy to make it overly positive and a lot less relatable through that. And at least on average across a highly varied population in terms of the complexity of the language, which we called kind of readability or kind of reading level of like how complex this language is, there was this kind of decent middle way that was not too complex and not too simple for most. In terms of downstream outcomes, here's what we learned. We learned if we make a reframe more rational, it is also more relatable. And by rational, I mean that we train our models not to make assumptions about you. For instance, not make assumptions about your social or financial resources, for example. We found that actually addressing the type of cognitive distortion that you select, making things more actionable, making things more specific, this is what people in randomized trials, again, then would also report as more helpful. And finally, actionable and specific also was kind of the right ingredients to make something more memorable. So somebody is kind of more likely to recall the same reframe the next time a similar thought arises. Now, as so often with AI, it often doesn't work as well for everybody. And I don't expect anybody to read the tiny, like 100 tiny numbers here. But we were quite concerned that this might not work for everybody, which is really the intention. So we did kind of a large study to figure out who does this work for, who does it not work for. And while we often find in such scenarios that there's big differences, for instance, across race and ethnicity, here the biggest differences were actually for teenagers, for young adults. So after deploying this for a while for adults and being happy with the kind of safety and quality of the tool, we also deployed this to adolescents, kind of 13 and up. But we really saw that kind of 13 to 70-year-olds consistently reported the worst outcome, like independent of the outcome, they had the worst experiences here. We then tried to figure out what might be going on. And one thing we did find is that teenagers seem to use a lot simpler language these days. Maybe some people in the room can relate, or maybe they in terms of their children, perhaps. People under 18 on average tend to use much shorter sentences and much shorter words. So we came up with the kind of not shocking hypothesis. It's like, well, what if we adapted our reframes to more kind of follow the similar style of language? So all we're doing is we keep everything the same, but then we have yet another language kind of make the reframes a little bit simpler and a little bit more casual, which is something that language models can do to a decent degree today. And what we found was that immediately, and again, this is a randomized trial, we could see that here, this is 13 to 14-year-olds, they would find these reframes more relatable and more helpful without actually reducing any of the other outcomes. So here, kind of essentially what we did is we learned that there are some subpopulations that have significantly worse outcomes, then identified or kind of explored and found one potential reason why this might be. And then kind of adapting for specific subpopulations, we found some ways how to improve these outcomes and really raise the floor in terms of the performance of this tool for everybody. Since then, kind of after some of these promising RCT results in the wild, we invested in a classic pre-registered clinical trial that we just finished recently. This is not published yet, but we essentially found similar things in the sense that the reframing is more effective in this human AI collaboration version where you do have access rather than when you do it yourself. And we speculate, like we also see that people then use the tool more often. So people that were randomized to the condition where people had AI support, they would actually use this tool about 5 times instead of 4 times over the course of the study. And we speculated it's because of better initial experiences with the tool that people are willing to engage with this more often. Engagement is kind of a holy grail in digital mental health. In many ways, I actually think that the key is kind of access and engagement more than actually improving the quality of support, for example. And to also tie this now to this no training wheel metaphor I want to use in this talk is here in this clinical trial, we paid people to use the tool a couple times a week for the first 4 weeks. We measure outcomes every week. And then after another 4 weeks, after 8 weeks total, we do another follow-up. The y-axis is based on a kind of established scale about how well people are able to use this skill outside the digital tool in their own lives. So this would be people saying, I can catch myself thinking negatively, I can recognize the biases and reevaluate the situation. And essentially what we see, so all of these numbers here, they're intentionally measured as training wheels off. How much does this tool actually affect you, what you can do outside this tool during kind of most of the rest of your week. And we find that people get better at these skills and that at least for a brief kind of 4 additional weeks that skills do not drop. So we're kind of hopeful that this can actually lead to somewhat sustained learning outcomes in people learning these valuable skills. I'll now change gears and tell you about project number 2 and skill number 2. And this will be about conflict resolution and about having difficult conversations. And again, here we'll add deliberative practice and constructive feedback to the mix in order to help people learn these skills. And I'm sure everybody has their own kind of favorite or least favorite examples. There's just lots and lots of conversations that are quite difficult to have. Maybe you're discussing healthcare options with an aging parent. Maybe you're negotiating a salary with your manager. Maybe a friend hurt your feelings, or you're trying to get somebody to return the money that they once borrowed. Whatever it might be, kind of difficult conversations are part of our lives. Why are they difficult? I think there's at least kind of 2 main categories. On the one hand, we often don't really know how to best have these conversations. Nobody kind of trained us to be particularly good at having these conversations in terms of the strategies to use and what to use when. But there's also this kind of explicit emotional component where even if you're in principle pretty good at this, when kind of strong emotions can easily come into the way, maybe because you're worried about the outcome of the conversation and so on. So how people currently use the skill is as follows. Very, very, very few people have access to professionals. Like this is a skill we can all learn, just like most other skills. And if you had access to a professional, like they might simulate difficult conversations with you, they might provide deliberate practice through that, they might give you just-in-time feedback from this expert, and that is generally quite effective. But the reality is most of us do not have access to professionals to kind of practice these. Even the most privileged of us probably do not have access to that for all the difficult conversations that we're having to navigate in our lives. So most people really have access to more static resources, like on the worksheets on the web and so on. And it turns out that this kind of in-person training is often effective, but it's not accessible. While whatever is accessible is often not as effective as we would like because it lacks this deliberate practice and this constructive feedback. So one of my students, Ina Lin, she built a system called Imbue. That's a interactive training system for these type of skills. It's again backed by language models. It will simulate the difficult conversation you're dreading to have, and then provide just-in-time feedback, both about how to have this conversation, as well as kind of this emotional skill learning about kind of keeping your cool during a difficult conversation. And I know as you might have your own favorite examples how computer scientists aren't necessarily great experts in conflict resolution. So thankfully we get to collaborate with psychologists, and there's plenty of established frameworks in the clinical psychology world of how we can train these skills. And specifically, we embraced one coming from dialectical behavioral therapy, DBT, and it goes by the Dear Man acronym, which kind of is an acronym for the individual skills you can express. You can, for instance, describe kind of clearly and concisely the facts of the situation. E is for express, kind of using I statements, for example, expressing your emotions. And the other is, I won't go into all the details, will be about asserting, reinforcing, negotiating, and it also has explicit emotion regulation skills about being mindful and appearing confident. And I'll show you a system. This system, unfortunately, was not optimized for mobile devices like the previous one, so I expect this is quite difficult to read. I'll read out the key parts, but I just want you to have a good understanding of the flow of how we teach this type of skill. So at the top, somebody would come in and actually share a situation that they're dreading to have, that they're uncomfortable about having. And the scenario I'll play through here is about my dad having difficulty to remembering his medication, and I'm considering to hire a nurse to help take care of him. He disagrees. He doesn't think I need help, but it might be my goal that I really think is, I know the best for you is really if we can hire an assistant. You might not even know how to get started. So we can provide kind of skill suggestions, and maybe it's kind of, especially at the beginning of a conversation, it's a really good idea by kind of describing the situation and the facts that are going on. I can then kind of select a skill that I want to express. And here I'll be a bit boring. I'll do exactly what the AI suggested in terms of using this describe skill. And now I get to write out the skill. So first I get to exercise this skill myself. For instance, I might say, it's like, you kept forgetting to take your meds. It's so bad for your health. And now I can get some feedback on this response. So I'll click here. It'll take a few seconds. And now we have like different elements. I'll get into a few slides in more detail, but we can essentially assess how well are you expressing the skill, and we can provide specific personalized feedback. For instance, removing an emotional statement about like, it's so bad for your health, and so on. And now after that, I could rewrite my statement, kind of try to better express these skills. And once that's done, we can actually simulate the situation forward, where we simulate this conversation partner. We can actually step through this conversation potentially even multiple times to be more comfortable in the situation, but also learn the best skills to do this. So in the system, there's really these two components. On the one hand, there's the simulation of a participant-provided communication scenario. So there's kind of this bespoke simulation of potentially like here this dad. And then we have this expert-like, and I'll actually demonstrate that later, but I think this was one of the most exciting findings. We can actually use AI to give pretty high quality feedback today. Give this just-in-time feedback. And there's, for instance, if I maybe say something suboptimal by like saying, you constantly forget to take your meds, it's so bad for your health, we could generate feedback that says like, well, kind of stick to the facts. How many times is constantly really kind of, this can come across as judgmental language, and kind of improve how to have these conversations. Now, so really kind of from a computational perspective, there's these two tasks here. One is given a situation, an utterance, in this case by myself or by the user, and a skill I want to express. We can rate how well we're doing that and generate some feedback. And we can also kind of actually help people in the first place with what are actually good strategies to express if you're not sure about this either. And we do this in kind of a multitask scenario, how we use one language model to generate all of these jointly in an effort to have a relatively quick kind of inference time and be able to provide this feedback relatively quickly. Now, how did we go about building the system? We first worked with kind of lay people, in some sense, as the intended audience of the system. We asked people for the type of conversations that they're dreading to have, that they're kind of avoiding to have, and so on. And then we worked with some experts in this kind of specific theory or skill of DBT Dear Man at the University of Washington to collect really high quality annotations of when should you have given feedback, what feedback should you have given, and so on. And when we evaluate how good this feedback is, and I mostly want to point out one thing, even the best language models today, out of the box, actually don't do a particularly great job at this feedback. This 6% number here means how often would the AI-generated feedback be essentially the same, essentially as good as the experts? This is true only 6% of the time using even a relatively strong language model like GPT-4. And by adding a few bells and whistles in terms of controlling these language models, we're able to get this number up to over 80%. Kind of really most of the time, like literally matching the kind of quality of the feedback of an expert that was kind of rated by blinded people in the human evaluation. I won't go into detail for some of the other numbers, but just to say, we did also do all kinds of automatic evaluations of the quality of this feedback. And while they mostly point in the same direction, actually I'm quite skeptical of automatic evaluations of complex constructs in NLP. And none of the metrics that we used actually were able to really reveal this kind of quite stark quality difference that came out of this expert evaluation. But the proof is really in the pudding. So I'll show you a randomized trial with about 80 or so people that we randomized to either kind of practice the skill using only simulation, only practice, and the other group getting both the simulation, but also the feedback. And we asked a bunch of people to give us 2 communication scenarios that we're kind of dreading and avoiding to have. And those had to be a 7, 8, or 9 on a 9-point Likert scale. And here's how the study worked. So essentially, kind of new participant comes in. They would need to share 2 situations that are both pretty difficult, but we take the most difficult one and actually hold that out for later. And we'll first use the kind of difficult, but not the most difficult version for training. Even before we do training, we now actually have them simulate the conversation. So all of us will be kind of slightly better or slightly worse at these skills. We want to measure that prior to any training. However, and I should have highlighted that on the previous slide, actually everybody is getting the typical DBT Dear Man worksheets and training methods even beforehand. So even we're trying to set us up conservatively so that the type of kind of static training tools that are available to people today, we make them available to everybody. So they will not, basically we will only see differences in kind of after versus before training or across these randomized groups, only if there's actually value that goes beyond what we already have. I know plenty of hype around AI already. So after we get kind of how good are you just kind of walking through the door in terms of these skills, now we're putting training wheels on and we'll do kind of deliberate practice and feedback. But this is kind of where the randomization come in, where we either have a simulation only group or you're randomized to also receive feedback. And then after this training, where we have a full conversation for this first situation, we take the training wheels off. We'll now have another version of this situation, but now you don't get any feedback. And we'll measure how well you're doing this. And then we'll take this second situation to measure, well, how much do these skills actually generalize to a new situation that we didn't specifically practice. All right, now we're going to look at this from 3 different angles. We're interested in people learning the skills involved. And here we use kind of machine learning methods that we developed and validated to measure how well you're doing this. And then there are self-reports for reducing negative emotion or how comfortable you are about having those conversations in the future and your self-efficacy. So let's go through these one by one. Do people improve their skills? Yes, they do, but only when they only get feedback. Simulation alone, after having also kind of already seen these kind of static traditional training materials, only when you get actual feedback, you improve in the skills. But we see this both for kind of the conversational strategies as well as the emotional regulation kind. Both kind of really only change and improve significantly when you have access to feedback. Now, on the emotional side, we look at how angry, fearful, sad, or disgusted you are by this situation. And the hope is that there's a reduction in negative emotion. What we actually see is that even just having the simulation alone already leads to significant reductions in these negative emotions. Just being in that situation and practicing that can have this positive effect. But we actually see that the effects are much larger when you also have access to the feedback. And for anger, for instance, the difference was only significant for the group that had access to feedback. And finally, we look at self-efficacy, your confidence, worry, hopefulness, and motivation, kind of before and after kind of training. And here what we find is even simulation alone it kind of makes you more confident in your ability to have this conversation. It makes you less worried about it. But again, we see significantly larger differences when people had access to feedback as well. And for some self-efficacy measures around hope and motivation, we actually only see improvements when people also had to access to feedback. So long story short, even a single session in terms of this tool could demonstrably improve people's skills and emotions. And while emotional regulation skills already benefited from some simulation, really the best outcomes were achieved with additional feedback. Now, I usually spend a much longer part of my talks about the ethics, where clearly, especially in mental health and in AI technology doesn't only create opportunities, even though I very much believe in them, it also creates risks. So I want to briefly summarize some of the things we do in order to responsibly develop and evaluate this type of technology. I think one of the most helpful things kind of in order to anticipate and minimize risk, it was particularly important to co-design these risks with the various stakeholders. So we tend to work with people with lived experience in mental health, clinicians, other mental health experts, patient advocates, for instance, at this Mental Health America organization. A lot of time is spent in operationalizing principle-based ethics frameworks that some of you might be familiar from typically biomedicine. And then kind of the big questions are, how do you operationalize them in the context of these type of AI and mental health applications? Of course, we get informed user consent in all of our studies are IRB approved. We have certain type of content filtering, both through automated algorithms as well as giving the users agency and the ability to flag content that they don't think is helpful. And finally, we do spend lots of time in some sense red teaming or kind of through this collaborative stress testing with people with different experiences and expertise before we put these tools in front of anybody. Before I summarize, and then I look forward to a Q&A with you all, is I was able to show you 2 examples and 2 projects today. I'm really convinced that when designed right, we can teach people complex critical skills through kind of AI-provided scaffolding, practice, and feedback. And we've seen this kind of through lots of other projects that I didn't have time today to tell you about. So for instance, we've seen that we can teach people how to express empathy particularly effectively. We've worked on, or in an ongoing project right now, we're working on clinician-patient communication in this kind of especially unfortunate and difficult scenario where there was medical harm. Clinicians made some kind of mistake, a patient was harmed, and now the clinician needs to describe that, talk to that, take accountability, and talk to that with the patient. extremely difficult situation that most people are not well trained for. We also teach people skills around critical thinking and fact-checking skills, for instance, in misinformation type contexts. And we're also in the process of deploying another tool that is kind of not in a mental health context, but is meant to give feedback on creative tasks, in this case, photography, where we can teach people to give particularly good constructive feedback. So to summarize, I really believe that we can teach mental health skills through AI, with the key ingredients being scaffolding, practice, and feedback. We learned a lot from deploying these tools at a large scale. We're extremely thankful for the many organizations that make use of our tools and insights, and especially the many amazing counselors and peer supporters and advocates that use their time and energy to support others. Without them, we wouldn't be able to do any of this. And I promised to highlight the amazing team that made all this work possible. The first tool was primarily developed by my PhD student, Ashish Sharma, and the second one by my PhD student, Ina Lin. And there's folks here from University of Washington, Stanford, and Mental Health America. And if anybody wants to try out these tools yourself, it's freely available to you at this link. I thank you again for inviting me. I look forward to your questions.
Thank you so much, Tim. That was very, very cool. And as we are waiting for students to raise their hands and ask questions, I can probably ask one question. I'm very curious how these methods work. Like in the first project, for instance, how did you end up using the language model to generate a more empathic reframing or a more specific reframing for the user? And in the second project, how exactly was the imbue system built? Was it a trained model, prompted?
That's a great question and a totally fair one, because I left out lots of technical details here. So in the first project, you, for instance, highlight how do you make something more actionable, more specific. So really all these systems in the end are really a combination of often 10, 20 different components with kind of fairly specific functions. So on a high level, the first system around cognitive reframing is based on a retrieval augmented generation approach with a curated database of thoughts, cognitive distortion, annotations, high quality reframes. And that was kind of a big part of controlling the quality and safety. But then we have kind of additional tools, for instance, for classifying which cognitive distortion it is, or for instance, as you mentioned, like how do you make something more rational or more empathic? So those are all kind of systems in their own rights that most of the time are based on language models as well, that measure these constructs. So for instance, the kind of system that measures how rational thought might be is based on identifying assumptions you might be making or assumptions behind assumptions that we use in a way to score this. There's, of course, a lot more detail in the associated papers, but it's basically kind of all mini projects, how to take complex social or psychological constructs, operationalize them, try to do a good job with that, and then validating with domain experts that were at least doing a decent enough job of that. Maybe to give another example in terms of how actionable something is, sometimes a thought might kind of straight up suggest an action in which it kind of by definition would be actionable, but the tool behind that we built to measure how actionable something is also kind of looks at the type of actions that are implied by a thought. Is this a particularly kind of nebulous, very broad set, or is it very focused? That is like, yeah, you didn't kind of tell me exactly what to do, but I still kind of know exactly what I should do. So we build tools that essentially operationalize these individual constructs. On the second tool, the imbue system around conflict resolution, and that's also something where I admittedly jumped over a few details. I mentioned that the base model GPT-4 only 6% of the time was able to match expert quality feedback. And we did get this over 80%. And here are some of the kind of key ingredients that got us there. So this is relative to kind of just the prompt tuning of GPT-4. Significant improvement happened with some retrieval augmented generation, where we again have a data set of high quality responses that we can draw from. That kind of was responsible for a decent gain. We then added a chain of thought-like kind of step-by-step reasoning steps that again lifted the performance a little bit. And then one additional detail that helped quite a bit was that this retrieval part that finds similar situation in your training data essentially to generate the best feedback, that we didn't only do this based on kind of the example at hand. Maybe you do a particularly poor job of expressing some skill. We're not only retrieving other poor examples of the skill, but we always have these contrastive pairs of here's a not so great way to express the skills, and here's how in the exact same situation, how you would do better in expressing the skill. So doing this retrieval augmentation on these kind of contrastive pairs directly actually led to another performance improvement that we speculate is just about that we're helping the model figure out, like, well, there's kind of a longer utterance, kind of what is really the key difference in terms of how to make this better and to be able to apply that and generalize that to a new situation. So those were some of the key ingredients where, again, the individual components, we would then do quality checks and validation with kind of experts in this given domain.
Got it. Thank you. Sorry, I didn't mean to ask like a very long question, but we have another question from Yuichun.
Oh, yes, thank you. I actually have one question. May I ask, like, what according to you is the hardest part in your research?
That's a great question. I should, wish I was better prepared for this one. I think one big challenge, like, I think there's a challenge with respect to kind of larger multidisciplinary teams, and it literally takes us years as computer scientists to learn how to understand even the basics of psychology and clinical psychology, learn each other's language. And I think that's worth calling out. And maybe from a more technical perspective, I'll point out that language models today, kind of say your ChatGPT, we're making all kinds of ridiculous assumptions that are wrong most of the time in terms of how we design these systems. And many times in mental health, those are situations in which they're violated. For instance, in order to best practice these kind of conflict resolution scenarios, it's actually not helpful at all to have the most helpful, polite, immediately cured type of kind of chatbot experience that so many of the assumptions that we make kind of across many domains that, for instance, are encoded through certain type of alignment or RLHF type processes, often very, very off, and kind of undoing or kind of finding the right ways of doing that for a given application. For instance, how to really ensure safety in higher risk mental health scenarios. We find quite difficult and actually spend most of our time on those.
Thank you.
Yeah, thank you for the question.
We have some other questions in the chat. Lindsay, who's another of our CAIS associate directors, asks in the same vein as Swaba's question, can you describe the nature of the data on which your large language models were built?
Yeah. So there's lots and lots of data sets that are responsible for different components, but I think the key pieces are that the data sets are extremely important, and that's probably why you're asking about it. I think to really control the behavior of our AI systems, having high quality data sets that are not synthetically generated or generated by computer scientists, but are really created by the experts that know what good cognitive reframing looks like, what good expressions of DBT or DRMAN skills look like, We spend lots of time on collecting data with the relevant domain experts to improve these systems.
Ananya asks, how random were the randomized control groups? What all factors did you consider while sampling people for the study?
Yeah. So in some sense, the randomization is just independent at random, but I think your question also importantly asks about how do you select the population that you recruit for your study in the first place? And that's something where I can just only give massive credit to this awesome Mental Health America organization through which we gain access to, I think, a really meaningful population to work with. So when I mentioned that 160,000 people earlier had used this cognitive reframing tool, this is among the about 10 million people that come to the Mental Health America website every year. This is a population that is looking for mental health resources. It's one that has typically not been previously diagnosed or treated, typically does not have access to any other forms of treatment. Scores relatively high on typical clinical assessments like a depression scale or anxiety scale. They often score almost shockingly high given how little they have access to. And it's about, I know, 80% or more would, for instance, report that they have a household income of under $35,000 a year. This is in an American context. So I kind of, through collaborating with amazing organizations like Mental Health America, I think it's been really great to work with the type of populations that we really hope to reach with this technology, and those are also the populations we've recruited and that have reported on in these different randomized trials.
Thank you. Next question by Ameya. And we're a little over time. Hopefully that's you could stick around to answer like the last 4 questions.
Okay.
So Ameya, since the tool can be freely used at any point, can we make the training wheels aspect more explicit? From the practitioner's perspective, do we need to do this?
Yeah, it's a great question, and I think something where we still have more questions than answers. For example, kind of how much time you need kind of learning these tools, and kind of how do we know when it's the right time to train these, take these training wheels off? The truth is, I don't really know. We do have some data, for instance, in this 8-week RCT that I talked about somewhere in the middle. We did see kind of no further skill improvements for our current system after 3 weeks. So while we had guessed at the time, maybe about 4 weeks feels about right. Turns out maybe 3 weeks would have been enough, at least to get the same results. But who knows, maybe with a different system, we could do better. But I think so I wish I had much better answers, but I think your question just greatly points to important open questions. I think also how do we better integrate these tool use into people's lives? How do we better integrate them into traditional forms of mental health care? There's, I think, lots to be done kind of for meaningful integration. And all we've done is really mostly study kind of individual uses of these kind of pretty short-term interventions.
Yeah, so to take that to the other extreme, the next question is by David. What if we become too dependent on the training wheels? If deployed at scale, how can we control these tools, especially when dealing with sensitive issues like mental health? We don't want to repeat catastrophes like the recent, character AI teen suicide case, or they also point out an eating disorder with chatbot case that was covered recently in last year.
Yeah, this is a question that's really close to my heart. I was saddened to see, for instance, the latest story that you linked to in the New York Times. At the same time, from what I understand, what these tools do is not really mental health care, but they provide kind of substitute goods for friends, often kind of romantic partners, girlfriends, etc., and then often engage in highly sexualized interactions with chatbots. I'm not shocked that maybe some of the engagement statistics are relatively good, leading to ridiculous evaluations of these kind of organizations. At the same time, it really doesn't take great expertise to have significant concerns that this might not be the best way to support people's mental health or deal with loneliness. I think in some sense, I think the shocking stories that you brought up, I unfortunately expect to see more of them unless we find better ways to actually through regulation or other means establish kind of practices, what it means to do this responsibly. And I think these kind of simulated girlfriends, I think, are pretty low on the list of what I like, the kind of opportunities versus risks in my kind of personal assessment. This is precisely also why I tried today to really highlight the training wheels aspect, in the sense is we really want to teach people meaningful skills. And we evaluate kind of ourselves, and we evaluate the success of this technology if it's able to do this without kind of creating these dependencies. Yeah, I think this is an extremely important part. A lot of the research that's currently going on in my lab is around safety and how would we evaluate these types of tools for safety, because there's currently no standards whatsoever, and lots of bad things happen, likely millions of times a year in the US alone. Yeah, so thank you for bringing that up.
Yeah, yes, definitely like the latest article about, or like the latest news about character AI, like really changes how we view these technologies very drastically. On a related note, John asks a question about engagement. Engagement can be a challenge. Do you find that folks are engaging more frequently with these AI-based tools?
Yeah, absolutely. Engagement is, in some sense, I see it as the holy grail. And especially like real world engagement does not look like hour-long sessions with kind of traditional clinical tools. So I think there's a lot of work to be done. And in many ways, I think this is what we are finding about these AI tools, that really the most promising part is in the engagement piece. We did find, for instance, that engagement rates, completion rates, or people returning more frequently to the tool to use it again, not yet to a degree that I'm concerned about kind of dependence, as in maybe the previous question, but we see overall signs that we can provide much better initial experiences when people are totally new to these type of skills. And we are speculating, we haven't proven yet, but we're speculating that these much better initial experiences actually encourage people to then come back to these tools more often, compared to how this has worked in kind of a digital mental health scenarios without similar support.
Okay. Yeah, one related thing I was thinking about is, yeah, perhaps like with a therapist, you can expect some notion of empathy that's coming from, a trained professional, whereas do you find that some users often dismiss these tools as like, oh, it's like a AI tool, how will it know what I'm going through? Is that something that happens and you're explicitly
I regularly get questions like that, and I find it entirely reasonable to believe that this will not work amazingly for everybody, and that is totally okay. Actually, in my experience, we hear it way more often that somebody comes and is maybe, for instance, might say things like, "Thank you so much for these type of tools. I don't have a single person in my life that I'm comfortable sharing this with." That actually the entire fact that this is an AI tool that's maybe not perceived as judgmental, that this is, and that many people really do not have an alternative to this. So while I don't want to come across as preaching that this is the better solution for absolutely everybody, And for instance, I really don't expect my grandparents to use these tools or to be particularly excited about it. There are people for whom they work, and there are some people that are not currently well served by all the solutions we currently have. For instance, we also hear from people that even have the opportunity to work with a therapist, and they would say, I'm actually really worried what my therapist will think about me if I tell them X, Y, Z. So I prefer talking to an AI. And of course, there's a lot to unpack in that particular scenario, but there's actually a lot of people that are not well served by current tools that might be served by these type of solutions.
Yeah, I can totally see that. And then maybe one last question by Monica. How do you confirm the reliability of the responses from AI subjectively? You talked about DBT as one resource, but someone might need another process like CBT or ECT. It depends on the individual's diagnosis. So how do you check that just in time or suggest to come up for this in the future?
Yeah. So there's a couple aspects there in terms of like assessing what we kind of discern in quality. We do a combination of working with experts in this particular domain to assess the quality of, for instance, reframes or feedback on DBT skills. At the same time, much of mental health is assessed through kind of first-person self-report. So rather than having non-domain experts and a third person assess whether this was a particularly relatable reframe for Tim, I don't actually think this is a particular meaningful exercise. We try as much as possible to work with people themselves and have them tell us whether this was working for them or not, whether it was relatable for them, memorable for them, helpful to them, which really only them in that moment can decide. So this is something we anchor a lot of our work in. The other thing you're bringing up as well, different people at different time will need different solutions. And I don't want to, basically what I've presented is much, much less than what most psychotherapists would do. None of what we've done even comes close to replacing kind of entire forms of therapy that involve so many more things. I do see lots of opportunities, especially around skill training, especially around like therapy, homework, worksheet type of things to better support people in that. But there's lots and lots and lots of aspects to these important treatments that are not currently supported. And lots of our ongoing work is focused on providing exactly those kind of additional tools and solutions. I also see that you ask about prompts and so on. If you look up the relevant papers, we typically share all the data and relevant prompts and appendices and so on.
Thank you so much again, Tim. This was extremely amazing, and I will invite all the participants to virtually clap, and I will clap loudly.
Yeah, thank you so much for having me. It's a great honor.
Thank you. All right, bye everyone.
Take care, everyone. Thanks for having me.